Hello, my name is Jordana Murby. We're going to be talking about the medical clinic apprenticeship for just a little bit and sharing some information. So first, our mission and approach. The traditional thought process is to treat animals just like they're going to be alive for stray hold and euthanize immediately due to suffering, even if it's temporary suffering and the animal can recover. The gold standard traditionally has been the only acceptable way to treat animals. We can't afford that. Not many shelters can afford that. Most rescues can't afford that. So our thinking is that if we can provide what the average pet owner can, that should be a new standard and just as acceptable. So our aim is to provide just that average pet owner medical care to these animals. Our resources are not limitless, much like average pet owners. Not many people can go out and spend thousands of dollars on individual animals, and we can't either, especially if we're trying to save as many as possible and share all of our resources across the board. We make our medical decisions based on these bullets. So we treat life-threatening conditions. We alleviate pain. We treat conditions that will get worse if we don't act on them, cure conditions that will lead to long-term pain, and we will provide non-life-threatening conditions if we have the resources to do it, and if we feel the animal will really benefit from those. So medical care at Austin Pets Alive, our goal is to save all salvageable animals. So this means anything that is not suffering, poor quality of life, treat them like they're going to live. So a big part of this is vaccinating immediately. We want to give them the protection that they need while they're going to be staying with us in the shelter environment so that they're not picking up any diseases or viruses. Systemizing treatments is incredibly important. Vet-approved protocols is how we do this. And how we encourage other rescues and shelters to save these animals. Get animals out. You don't want to hospitalize long-term. The goal is to provide short-term hospitalization, stabilize animals, and then get them out into foster homes. And the reason this is so important is fosters can provide one-on-one care that we can't in the shelter. We're touching multiple animals a day, sometimes up to 20 and 30. So, we don't have the time to sit with each of these animals and even just, give them the love and care. We want fosters to do that and provide that. Killing is not an option. So there's really not such a thing as we're too full, we're too busy. You really have to just kind of get creative and figure out how to manage these animals in the population. So the definition of euthanasia has been to look at quality of life. That's what we want to focus on. Extreme suffering, are they in pain that can't be relieved? Are they senior and they're painful without a chance of recovering from it, versus a definition of kill, which is killing animals that are not suffering from incurable pain and have their long-term plan or their long-term outlook is good. So justifiable euthanasia, again, is quality of life, and it's long-term and short-term. So if they come in and they're in shock, they have white gums, they're unresponsive, sometimes this is a reason to provide euthanasia for them. If their body will not be functional again, broken spine, severely maimed, these are conditions that we feel justifies euthanasia for these animals. Or if they're dying from a chronic illness when they get here. An example of this would be kidney disease. Sometimes we get these animals that are at the end of their life, and we can't really get them back from that. Arthritis that can't be managed. especially in senior animals, is a justifiable euthanasia. And then there's the behavior issues. Untreatable aggression, when you're working with a behaviorist, is, again, another reason to euthanize. So making it happen. So our staff, we have veterinarians, managers, and technicians. Our veterinarians are our gold. They are our lifeline to treating all of these animals. We have managers in place to keep the clinic functioning, kind of work as a go-between between veterinarians and technicians. Even though veterinarians and technicians do work very close together, the managers are kind of the operational people of the clinic. In the APA clinic, we have 4 tech positions. We have an appointment technician that will see all of our fostered pets. So every 30 minutes, we have a new foster coming in for either wellness care, illness injury care, follow-ups, rechecks, all those things. We have a cat tech and a dog tech that will see and treat on-site animals. And then we have a hospital tech that will treat hospitalized patients, as well as run into our parvo ward as needed, or just kind of in general if we need an extra set of hands. So the way we save money and time, this is a big one for us. We do not run tests unless it's absolutely critical. And the reason we do this is because what do we do if the test result is negative? We're going to do the same thing that our vets had initially wanted to do. So if the outcome isn't ultimately going to matter, it's not going to change our treatment plan, then we'll omit the test and move forward with just doing the treatment. Nature is your biggest ally. A lot of these animals will heal on their own with a little bit of time. Broken bones, if the joint's not affected, we'll cast them, splint them, and put them into foster homes and recheck them as needed. We don't order expensive drugs. You know, there's the basic antibiotics and pain medications that can work just as well. The expensive drugs are nice to have, but they're not necessary by any means. So we save money and time by donations. Being able to accept donations and use them is huge for us. Tangible supplies, so we'll ask for gauze, exam gloves, all of those little things that save us $2 here, $3 there over the course of a year. That really adds up. Accept all donations. We don't limit the donations that we accept because we find that a lot of our most valuable donations come from, you know, the middle of a bag or the bottom of the pile. And we don't want people to think that we don't need stuff. Sorting through donations does take some time, but it is well worth it. Volunteer help is big. The great place for this is in surgery recovery. It's very hands-on. It's fairly easy to learn with guidance and a couple days of some good training. We break up tubes and bottles, for example, eye medications. We rarely send whole tubes of eye medications with animals. We may fill a syringe and send a portion of the tube. Same thing with flea medications. We'll buy the large dose and dose down per weight of that animal. And then also find alternatives to expensive medications. And then foster homes, again, are a great resource. Many times foster parents want to provide not only the housing and the food, but also medications. So what we see and treat, so our markers are quality of life and long-term outcome. We're looking to make sure that there is a good long-term plan for these animals. Once you get to treating sick and injured, it's important to have a plan in place for what's going to happen to them in the coming days, weeks, and even months and years. So these are the different illnesses and conditions that we see and treat. A lot of most shelters and rescues have thought that it's not possible to do, but with limited resources, you can still treat these. Again, it goes back to systemizing treatments, following protocols, and just kind of getting creative. So our veterinary technicians are a huge key to making these things happen. So they are the boots on the ground that follow the protocols. This allows them to treat 20 to 30 animals a day, and then only elevate the more unique and critical cases up to the vet, allowing the vet to use their time as effective as possible. Techs do become empowered to do this. A lot of times it can be scary for veterinarians and technicians to be following these protocols without running things by the vet. But it's it makes people feel good about what they do, and it makes them want to do better. Time management and triaging is important. Self-managing their day is important because they're working with other teams. Sometimes they may have to wait for behaviorists to be available, for a member of the CAT staff to be available to help, and then being comfortable with asking for a second opinion. None of us are the end-all be-all of any decision, so we really encourage our technicians and our vets and our managers to ask for a second opinion as needed. So for managers, our manager duties are ordering and purchasing, maximizing donations. Sometimes this means the managers will go through donations to make sure that we're keeping what we need and what we could use versus throwing out things that we think we may not need in the future. Triaging cases, managing medical cases in conjunction with fosters, and making sure that their needs are being met. Working with community vets is a big one. If you can make partners with vets in the community, they are going to be a great resource. A lot of times they want to donate time or supplies, so making sure that those relationships are good relationships is important. When to step in and help on the floor. So the day, the staff are seeing a lot of animals, the vets are seeing a lot of animals. It's easy to want to just jump in and help, but when that happens, the operational stuff is getting left by the wayside, and that means that the clinic isn't going to be running as efficiently as possible. Continuing education for staff. As you grow your clinic and you grow the conditions and the illnesses, injuries that you see, your staff is going to need to be learning as they go. So expansion does mean expanding education also for everybody. Crowdfunding is a big one for us. The managers will identify the animals that we can or should crowdfund for and work with marketing to get those out there. Creating protocols that are effective and easy to use. Updating protocols as needed, identifying which protocols aren't working and which ones need to be changed can be very important. You could make all the protocols in the world, but if they're not effective, then it's not gonna do any good. Our veterinarians, these are basically their goals on a daily basis. They want to manage chronic cases, provide diagnoses without testing. They're really good about using their physical exams, what they're seeing, what they're feeling, and kind of using their brains to try to figure out best treatment plans. Time management, we want to use their time as efficiently as possible. Empowering technicians, so the veterinarians need to be comfortable with the technicians following the protocols. It's really important. Again, you could have all the protocols in the world, but if our vets aren't comfortable with our techs working through them, they're not going to be effective. And then taking staff, volunteer, foster perspectives into consideration. We like to think of our staff, volunteers, and fosters as almost like owners. We value their opinions, and we're working together with them to make sure these animals are getting care, or the care that we want them to have. So that's just a brief overview of the medical clinic. It's a lot to take in. It's a lot of information, but it's a lot of fun. It's very rewarding, and we look forward to seeing everybody.